ज़्यादा मतलब क्या? We have to be very, very specific. Because more water may be different from me and different from a young boy, different from an old man. More water is not the same from gender, male to female and difference. It differs from season. Summer different, winter different. Difference from occupation. A sportsman different, a lawyer, a doctor different. So how to identify the correct number? There is no number called 2 liters or 3 liters. If you ask me, sir, give a number, I will say 3 liters. But the right formula you have to identify by yourself, by looking at the urine color. If your urine color is clear in color, it is transparent, that means you are well hydrated, slightly overhydrated. That is very good. You should be always well hydrated. So you should look at urine color, it has to be transparent. By afternoon, first urine in the morning can be yellowish, because in the night while sleeping nobody drinks. You may drink and sleep, but while sleeping nobody drinks. So your urine color by the afternoon should become transparent, that means you are well hydrated. If it is mild yellow, that means you are just adequately hydrated. And you should never be at that level, because if you do a function, you have invited 800 people for dinner. For how many people you cook the food? At least 900 or 1000. You should always be on the top. So keep your urine transparent, that is the correct. Identify your own requirements. If it is becoming dark yellow, orangish, reddish, that means you are getting dehydrated. There is high chance you will get a cramps, your performance will become low, your BP will become low, your kidneys will start becoming weak. And chronic dehydration can lead to kidney becoming small, shrinkage, and kidney failure. So drink lot of water. Lot of water means it should be transparent. Number 2, 3 liters. The second protocol is at least 1 fruit per day is important. Our diet has become devoid of fruits and vegetables. Even if you are a vegetarian, fruits are impossible to come in our diet. But if our relative undergoes a surgery, is sick, we go to meet him in a hospital or at his home, how do we go? We don't go with sweet balls. What do we take with us? Fruit balls. Because we know by fruits he will get health. By fruit he will get healthy. Fruits provide health. So in our healthy season, when we are healthy, to safeguard health, every day 1 fruit is important, because fruits has vitamins, minerals, and they give energy. Unfortunately, go to a doctor, sir, give me multivitamin, give me IV therapy, I need energy, my performance is becoming low, I need multivitamin. That multivitamin, if you have opened the capsule, the whole house will smell bad. Look at the smell of the multivitamin, and look at the smell of fruits. How fascinating it is, how enchanting it is. That's God's creation. So every day, 1 fruit is important, and we should reduce the protein intake. By protein intake, our generally South Indian diet is like a low protein diet, which is one of the best diet. So we should continue our same diet, but 1 fruit per day is important. This is rule number 2. Rule number 3, how to keep healthy is to do at least 30 minutes of exercise, physical activity. Whenever we tell physical activity, the common understanding is, sir, my court ko jab, I have to walk so much, I park my car over there, my walking is over, I reach to 10,000 steps, this is an exercise. My house is on the 4th floor, I have to walk so many stairs up, exercise enough. That is not exercise. It is walking. By walking at that pace, I may reach Secunderabad also, but still I won't be defined as exercise. Exercise means you should do a physical activity and sustain it at a level by which you are not able to speak 1 sentence in 1 breath. So this definition holds good for everybody. For a child, for a young athlete, for us also. For a 70-year-old gentleman, if you are able to walk at such a pace that you are able to bring your respiratory rate up, your heart rate up, and not able to speak 1 sentence in 1 breath and sustain it for at least 15 minutes per day, then overall 30 minutes, that means you are doing good physical activity. That activity reduces the chances of getting a heart attack, reduces the chances of getting a paralysis attack, reduces the chances of your kidneys from failing, and it reverses diabetes also, many of the times. So physical activity is important. 30 minutes per day we should target. At least 5 days a week, maybe you can take a cheat day here and there, but this is important. Rule number 4, we need to avoid addictions. By addictions, the classical teaching is, addictions means cigarette, ganja, alcohol, or something like that. But that is heroin or some expensive drugs, snake bites. This is not the addictions. The addiction of this century is soft drinks and energy drinks. Aateki, Pepsi, Thumbs Up, Coca-Cola, energy drinks, Red Bull, Hell, Monster. Those names are also dangerous. High caffeine load, high sugar intake. This is the addiction of this century. नहीं पिए तो ऐसा ही दिखता, नींद नहीं आती नहीं पिए. This is worse than addiction, and this is common in youngsters, school-going people. Every day they have to drink a Thumbs Up. So this addiction increases the risk of diabetes, hypertension, getting a heart attack, kidney failure, paralysis attack. So this addiction has to be stopped. It is very important. Rule number 5: we need to avoid unregulated use of painkillers and antibiotics. Small infections के लिए antibiotic, I have to do performance antibiotic. These antibiotics are killing us. Many of your relatives you must have seen in hospital. Sir, culture has come, urine has this infection. None of the antibiotics are working. It is a super bug. What to do? Antibiotic resistance. In this planet, this is not our planet. Before us there were bacteria. After us also there will be bacteria. We are the aliens here. That bacteria is preparing. Whatever antibiotic you give is having resistance, and no new antibiotics are going to come. So we should use judiciously antibiotics. We should not use it constantly. This will cause side effects on your kidney, and ultimately your kidneys will get damaged, especially painkillers. The problem with painkillers is it starts as a normal thing. Today I have a case, I have headache, I have to take one antibiotic. Zerodol, Hyphenac, SMS plus, overall, unlimited names you have it. You start taking it today. The headache persists tomorrow. One more. If my pain tolerating capacity is 8 out of 10, after taking that painkiller it becomes 7 out of 10. Then ultimately 4 out of 10. Then I can't survive without a painkiller. I don't take it every day. And ultimately the kidneys become small. They shrink in size and they fail. And this problem is more common with the ladies. The first person to wake up at home is the lady, the woman of the house. Get ready, make the children ready, send them to school, send husband to the office, then self, it is housework, or I have to go for work, and finally come home early, receive the kids, teach them, receive the husband, do the household work, make everybody sleep. The last to sleep at the home is the lady. So, such power, कहाँ से आ रहा? मतलब कि मेडिकल से 10 रुपए का पत्ता आता, पेन किलर रोज खाते हो, पी के सो जाता है, खा के सो जाता है. So these painkillers is a chronic abuse among ladies, females, and they lead to kidney damage. In the long run, 2-3 years later, what to do? Dialysis machine is ready. So unnecessary. Even if you get a fracture, pain goes in 4-5 days, but the painkiller is going on for 4-5 months. Just imagine the atrocities here. So this lead to kidney damage. We should never use painkillers unnecessarily. We should identify the cause of the pain. If headache is there, check your eyes number. There must be refractory error. Rectify that. Rectify your sleeping habit, eating habits. This pain will go. And pain is not the problem. Pain is the symptom of the original problem. If you forget the cause, then we just take painkillers. So avoid painkillers. So rule number 6 is controlling blood pressure. The problem when I tell controlling blood pressure is check नहीं करते कोई भी, check करे तो निकल जाता. Why should I check, sir? If I check, it will come high. High है तो get it treated. High blood pressure has no symptoms initially. It has no symptoms. Slowly the BP goes up from 120/80 to 140/80, then 150/90, then 190/100, then ultimately 200. That time the head starts paining. There is a high chance that time the artery, the brain can burst and it can cause a hemorrhage and a paralysis attack. At that time symptoms start. So waiting for the symptoms to come is wrong. We need to check our BP at least once a year. Everybody has to check that. And if you are a hypertensive patient, purchase the machine. It costs 1500 rupees. And check your BP daily. It's important. If you are driving a car, you keep looking at the speedometer, whether in the outer ring road, otherwise the flash will come. You get a challan at home. So similarly, if your BP goes high, you can get a challan of your brain, challan of your heart, challan of your kidneys. Because of high BP, the kidney filters rupture. Protein starts leaking and the kidney gets crushed and becomes small. So BP has to be controlled. We need to keep it controlled to less than 130/80, and it has to be checked regularly. Rule number 7, controlling blood sugar. The blood sugar has to be controlled. Diabetes also has no symptom. I'm closing very fast so we can have question and answer sessions. So diabetes, I just explain you the understand how sugar causes problems. In this glass of water, if I mix 1 spoon of sugar, high chance it will mix. You can't see the sugar. It will look like water. This is how our blood is. It has to have a sugar of 100 milligram per deciliter. But if it goes more than 200, 300, 400, how many people you all know the sugar is 400, 500, and while eating one more gulab jamun, nothing happens to me. All the attitude is correct. But in this glass, if I start mixing 15, 20 spoons of sugar, this water will change to a syrup. It will become like shira, sticky fluid. If I make it like this, it won't fall also properly. This blood also becomes very thick because of high blood sugar. It becomes sticky. Suddenly it gets stuck in your heart vessels. That is called a heart attack. You have to go to a hospital. Then they put a blockage on here. So what is blocking over there? This sugar. This thick blood. Then they put a stent and they open the heart vessels. Suddenly, in the brain it gets clot. Blood can't move in the small vessels because of the high sugar. Paralysis हो गया, ischemic clot हो गया brain में, कुछ नहीं. Suddenly, it happens in the eyes. The number 1 cause for preventable blindness is diabetes. If you can control blood sugar, you can prevent blindness. It happens over there. How many patients you have not seen whose blood has clot in their foot? They have to cut a toe. From the ankle, they have to cut the leg because there is no blood supply. It has stopped. The thick blood, viscous blood has got stuck. This is the reason why even diabetics develop kidney disease. Blood gets stuck in the kidney and the kidney starts failing. And there is no cure for diabetes. Trust me, in this world, till today, to my knowledge, as of today, there is no cure for diabetes. If you have diabetes because of a cause like obesity, then it may be reversed. But if you have diabetes where there is a genetic cause, it has been diagnosed, there is no reversal, there is no cure. There is only control. We can definitely control diabetes. When people are diabetes with 30, 40, they have not found a cure. How can we find? So we can control it. But if we go behind the cure and forget the control, we will get all these problems. And all these problems which arise because of diabetes have no cure. A tiger gets a tiger only. It cannot get a cat as offspring. So a non-curable disease gets a non-curable disease. So all these stroke, heart attacks, blindness, diabetic kidney disease, peripheral neuropathy, these are all non-curable stuff which could have been prevented on time if you would have controlled the blood sugars. So this is how diabetes causes. So we need to control blood sugars. Very important. Rule number 7. Rule number 8 is whatever we want to prevent, we have to keep on checking it whether it is there or not. Suddenly, if I give you a Kohinoor diabetes, every day in the locker you will see is safe or not. Safe. Same thing. God has given us precious kidneys which are more valuable than the Kohinoor. It has to be checked at least once a year. And how to check the kidneys? 3 things. The kidney structure, kidney function, kidney filter. It's very simple. Structure is by doing an ultrasound. Everybody once a year should do an ultrasound. It costs 1,000 to 1,500 rupees anywhere in the city. So by that you get information whether the kidney size is big, becoming small, has a stone, my bladder is okay, gallbladder has a stone, fatty liver is there or not. There's so much information we get by one ultrasound. So once per year, ultrasound has to happen. That shows the kidney structure. After looking at the structure, we will look at the kidney function, whether the kidney is working properly or not. That is by doing a simple blood test called serum creatinine. It should be 1. Then that is put in a formula by which we get to know the GFR. How much my kidney is filtering per minute. The normal is 100, but anything more than 60 is also normal. Third test is the kidney filter. It is good in shape, structure. It is filtering normally, the function. The result of the filtration is seen by the urine. You need to do 1 urine test once a year. Whether my urine is leaking protein, blood cells, pus cells, crystals, uric acid crystals, calcium oxalate, whether I am at a high chance of getting kidney stone. Such an information in any lab. The cheapest test, the one which has the lowest cost, called CUE. It is a urine test. So everyone has to do these 3 tests once a year to verify our kidney health, and then the 8 golden rules completed. I would like to open the session for open question. Any question you can ask me. Let me summarize the 8 rules once again. 1. Drinking a lot of water. That's very important. The urine should be transparent. Number 2. We need to take 1 fruit per day as a source for vitamins, minerals, as an oxidant source. Number 3. We need to do physical activity at least 30 minutes per day, to a sense that we should not be able to speak one sentence in one breath. Number 4. We need to avoid addictions, especially soft drinks and energy drinks. Number 5. Unregulated use of painkillers and antibiotics must be stopped. Number 6. Controlling blood pressure to less than 130/80. Number 7. Controlling blood sugar to less than 200 milligrams at any time of the day. Number 8. Checking your kidneys once a year by 3 things: kidney structure, ultrasound abdomen; kidney function, serum creatinine, GFR; kidney filter, urine test, CUE. Thank you.